All right, so it's going to be very brief. How do you describe a study area or a study location as the name implies? So basically, it depends on the type of study that you're interested in. So you could be doing a community-based study or you could be doing an institutional-based study. So a community-based study is basically a study that is done in the community, and the most common units of analysis for a community-based study is usually the households in the community. Okay, so if you're doing an institutional-based study, there are different kinds of institutions. You could be doing a study in the hospital or in a school or in a prison or in any other kind of institution. An institution is just basically a closed unit of people that are gathered for a common purpose. So in that scenario, that institution would be your area of study, or rather your location of study. It could be multiple institutions or just one single institution. Whichever case it is, you have to describe where you're conducting that study. And there are various reasons why it's important to describe your location of your study. So the location sometimes can be a physical location, as I've mentioned. Then in other specialties, it may also be a social or an experimental context within which your research is conducted. So it is crucial to describe this accurately, because your results and the interpretation of that result will depend heavily on where the study is conducted. And remember, the issue of generalizability also comes in. You know that generalizability is the ability to make an inference on a larger population when you've taken a sample only in that population. So it's important that you explain to us what that general population is. And definitely when you talk about how you would want to select your sample from that general population, we know that you have adequately explained that population in a way that it makes sense to us how you sampled from that population. And at the end of the day, we need to be able to make an inference or to attribute our findings to a particular setting or a particular group of people or a particular population, because we know that some settings, because they differ in terms of geographical area, weather, cultures, it may be difficult to make a conclusion about one group of people when you have actually done the study in another group of people. So that location where the study is conducted is very important. And also, if someone wants to replicate the study, it also helps the person to be sure that they are all doing the same thing. Okay, so for a community-based study, these are just key highlights of what you will have to describe. They are not in any way exhaustive, but using this, you can have a brief summary of where your study is conducted. You would always want to start with the exact location of the community, of the region, or of the area. That's a geographical location. Sometimes we use the longitude and the latitude as a landmark. Other times we try to use boundaries. There's some landmarks in the community that would help someone that's looking for the area to be able to find it. Sometimes you may want to use other neighboring communities around that community as a form of direction or location of that particular community. But you must be able to describe the location, the name and the location of that community. If you have key landmarks like a road network, rivers, markets, schools, places of worships, those are things that people can relate to within the community. And it also gives you an insight as to the size of the community, the common areas that people use in the community. And by the time you hear a community has some rivers, you're already thinking about their culture or their kinds of occupation. So you're just making the person reading your work immersed in your research in your area, so that the person has a feel of where this research is done and can use that even in the discussion to make some inferences or some analysis. You want to be able to describe some of their cultures or their ways of life. So you're going to be telling us about major occupations in the community, the general features like how educated are they, what are their common religious affiliations, are they mostly Muslims, are they mostly Christians, do they have major festivals, do they have any other key things. If it's a remote community or rather a local community, you may want to tell us about their governance structure and how the chiefs in the community, the king, who are the rulers of that community, probably how they choose their rulers, a brief history and where they are today. So if there's anything unique about this community that you feel will be important in discussing your results or in making future recommendations, you should bring it out while describing the location of your study. And you may also want to include a map of the area in that description. And that's an important aspect if you can get that. So that's for a community-based study. But for an institution-based study, like I said, there are various kinds of institutions. An institution is just basically a closed-knit setting where you have people that come together for a common purpose. So it's an easier way of finding your target population. Instead of investing in a wider community, you know that there is a cancer hospital, for example, in your state, and you need cancer patients. You would be wise to just go to the cancer hospital to get your cancer patients than going to the community to look for cancer patients. That would be a large a waste of resources and time. So for an institutional-based study, you also want to describe the exact location of that institution and any landmarks that would be needed to identify it. You want to give a brief history of the institution, probably when it started and how it has grown from inception till date. Maybe it started as just a regional, probably a small private hospital and has now grown over years to become a tertiary institution. We would like to also hear about that. You also want to tell us about the size of the institution. And in terms of size, for a hospital, you're talking about bed capacity. For a school, to give us an idea of its size, we want to know the student population and if it's mixed students or if it's just a single sex student population. You also want to know probably is it what range of students the school has. If it's prison inmates, you have prisons for males, for females, you have high security, medium and low security prisons, and so on and so forth. So talking about the size of the number of inmates population. So we want to have an idea of how many patients that pass through that hospital in a period of time, and the mix of the patients that the hospital sees, if it's a hospital. We also want to know the kinds of patients they see or the specialties that the hospital offers and the people that use those facilities. The geographical area where these people come from. So if it's a tertiary hospital, we want to know if it feeds a particular region or if it feeds just a state or just a community, so that we have an idea of where their patients come from, in case we want to be able to make some postulations or conclusions. And the regular routine of the institution. So if you're doing it just in a particular clinic in that institution, we want to know how often does that clinic run and what days do they have clinics, what size of the population that comes on those days, and so on and so forth. And so on and so forth. So I'm just going to pause at this point to take one or two questions. Today, like I said, is quite a brief class, okay? It's quite a brief